Hey folks, and now we're going to be talking about the heartburn and the indigestion. So this is about a heartburn feeling right over here, right now. So here, excuse me. I just had an acid reflux, from eating pizza at the Subway. Hold on for 1 second. Yep. So that's the lesson that we're talking about right now about the acid reflux and the heartburn. So yep. See this here? Now this is the person's stomach right here. That's the gas inside the stomach here. So right at the top here, the word here that says esophagus inflammation. Esophagus inflammation right here. And over here, I'll show you, or maybe no. So over here, and over here in that circle there, that's called the lower esophageal sphincter. Lower esophageal ESOPHAGEAL. Okay, here let me get the pronunciation here.
Esophageal.
Oh shoot! It's called, okay. It's the esophageal, not the esophageal. Esophageal. That's how you pronounce it.
Esophageal.
Esophageal. Gastroesophageal. That's the word that I was trying to get to pronounce for all this time. Esophageal. A lower esophageal sphincter. And the one on the bottom there, that's the acid reflux right here. Esophagus and a lower esophageal sphincter there in the stomach. See, that's the whole thing right here. So over here, that's the esophagus. Over here, that's the lower esophageal sphincter right here, and over here, that's the stomach right there. Okay, and over here, the message. What is heartburn? Heartburn is a painful burning feeling in the middle of your chest. It's not really in your heart though. It's caused by stomach acid rising into your esophagus. Reflux, which runs through your chest close to your heart. Heartburn is an occasional symptom for many people and a chronic condition. For others, occurring frequently. When it's chronic, you might have GERD, gastroesophageal reflux disease. Who gets heartburn? Who gets heartburn? Excuse me. Oh, pizza. It will make me want to burp. Acid reflux with gas. See? That's what it does. Who gets heartburn? Many people have heartburn occasionally. It can be triggered by an especially rich or acidic meal or by extra abdominal pressure, such as during pregnancy. heartburn that occurs regularly is a symptom of chronic acid reflux, GERD, which is also relatively common. Approximately 20% of people in the U.S. have GERD. Risk factors include having obesity, a body mass index or BMI greater than 30, and overweight, a BMI greater than 25, smoking, and exposure to secondhand smoke. Symptoms and causes. What does heartburn feel like? Heartburn feels like acid burning in your chest, which is pretty close to what it actually is. Your esophagus, the swallowing tube that begins at your throat, travels down through the middle of your chest to reach your stomach. Heartburn begins in this tube, but the feeling often radiates through your chest and sometimes into your throat. It's a burning sensation that can be mild to severe. When does heartburn occur? You may notice heartburn more when number one, lying down. Number 2, bending over. Number 3, you had a late dinner. Number 4, you had a rich, acidic, or spicy meal. How long does heartburn last? Heartburn may last anywhere from a few minutes to a few hours. It should go away when the last meal you ate has passed out of your stomach. Once your stomach has emptied its contents, there should be nothing left to come back up. Reflux. Depending on the meal, it can take 2 to 5 hours for your stomach to finish digesting. Rich and fatty meals take longer to break down into your stomach. What are the other symptoms of heartburn? It may be hard to tell the difference between heartburn and other types. Chest pain. If you're unsure about the type of pain you're feeling, it's always a good idea to discuss it with a healthcare provider. It may also help to focus on other symptoms that you might have with it. These accompanying symptoms can help you distinguish heartburn from a heart attack or from other esophageal disorders. If your heartburn is from acid reflux, you may have number 1, burping. Number 2, a sour taste in the mouth. Number 3, nausea. And number 4, regurgitation of food. Other atypical symptoms of acid reflux include stomach bloating and overfullness, hiccups, chronic cough, worsening asthma, sore throat, and wow, wait, that's a hard word. Laryngitis. That's how you pronounce it. Laryngitis. Difficulty swallowing or feeling like there's a lump in your throat. Chest pain similar to angina. Non-cardiac chest pain. What causes heartburn? When related to GERD. Heartburn occurs when stomach juices, including acids and enzymes, backwash into your esophagus. Your stomach has a thick mucus lining that protects it from these substances, but your esophagus doesn't. A valve at the bottom of your esophagus called the lower esophageal sphincter is supposed to keep stomach contents from coming back up, but Sometimes it's weak or doesn't close all the way. Different things can cause your lower esophageal sphincter to weaken or relax too much, such as number 1, inhaling smoke. Number 2, extra abdominal pressure from body weight, tight clothing, or pregnancy. Number 3, okay. That word and a hiatal hernia. Hiatal. Hiatal. Hernia. When your stomach pushes up through your diaphragm. Pushes up through your diaphragm. Okay, wow, wait. I don't know. What is that word there? Wow, wait, man. That's a hard word to pronounce. Okay. A diaphragm, whatever. Okay. A heavy meal that stretches your stomach and stays in it longer. Indigestion and gas. When gas bubbles rise up through your GI, gastrointestinal tract. Lying down too soon after eating. Certain foods including coffee, chocolate, citrus fruits, mint, and tomato sauce. Certain medications including birth control pills and blood pressure medications. Often more than one of these factors contributes to acid reflux and heartburn. Why am I suddenly getting heartburn when I've never had it before? If heartburn is relatively new to you and you haven't recently changed your diet or lifestyle, you may be getting it for other reasons that can develop gradually over time. For example, aging is heartburn may develop or worsen as you age because your muscles weaken, including your lower esophageal sphincter. Weight gain. Most people gain weight gradually, but symptoms of weight gain like heartburn can wow. Okay. I don't see it there. The heartburn can worsen. Okay, worsen as you age. Worsen as you age because your muscles weaken, including your lower esophageal sphincter. Weight gain. Most people gain weight gradually, but symptoms of weight gain like heartburn can appear suddenly when you reach a certain threshold.
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 Threshold. Medications. If you've recently changed or added new medications, ask your healthcare provider if they could be causing acid reflux. Is heartburn always caused by acid reflux? Heartburn is usually a disorder of the esophagus with acid reflux as the most likely cause, but there are a few other conditions that can cause the same sensation. For example, well, that's it. I don't have anything, for example, because I do all screenshot of them and I print them out through my phone. The one that I am recording it right now. So that's it, folks. Ooh, wow, wait, my arm is like getting tired, or maybe I was lying my arm down so much like this, but yeah, who knows, but whatever. All right, folks, so see you later. The lesson is over. Hope you guys enjoy the lesson.